Good morning to all of you. Thank you, Chairman sir. First of all, I would like to thank all of you from the Medicon family that all of you have supported us and gathered here for our 10th Medicon sessions. So without delaying, I will be speaking on medical ethics. Start with the introduction, definition of ethics, principle of ethics. What are the ethical dilemma, how to approach different ethical dilemma, and different few clinical scenarios which we see in day-to-day clinical practice. So, moral. What is moral? Moral is basically a learned behavior which defines an individual's own code for the acceptable behavior. They arise from individuals' consciences, they act as a guide for individual behavior, and this moral learning, since it is a learned activity, learned behavior, it is highly influenced by the surrounding environment in which you learn these things, how to behave with other people, how to talk with other people, how to react during the emergency situation, how to act during the emergency situations. So these are very important parameters for the morals. So ethics. Ethics deals with the rightness or wrongness of human behavior. There is a very fine line of difference between moral and ethics. So concerned with the motivation behind the behavior, and bioethics is the application of these principles to life and death issues. So ethical principles. So what does it mean, ethical principles? Ethical principles are guiding rules for moral conduct, influencing how individuals and group make decisions and act. Individuals and group, not individual, it may be a group. There are four basic core principles for the ethical principles, like autonomy, non-maleficence, beneficence, and justice. Apart from these four core principles, there are few other principles, namely fidelity, confidentiality, veracity, and accountability. There are other principles also like integrity, truthfulness, righteousness, but almost more or less all these other principles more or less can be clubbed together with these 8 principles. So we will discuss each and every principle one by one. So autonomy means patient's right to speak for their own health, the freedom to make decisions about oneself, the right to self-determination. Healthcare providers need to respect patients' right to make choices about healthcare, even if the healthcare providers do not agree with the patient's decision. Like in our day-to-day practice, a patient comes with HbA1c 14, we advise for the insulin, patient refuses, we try to convince them, still they refuses, we write a line that patient refused despite dedicated counseling, and we go with the patient choice. So this autonomy is very important principle. Remember this because it will come again and again during the case scenarios. So non-maleficence means do no harm. This principle requires LCDs to protect individuals who are unable to protect themselves. Beneficence means doing good for others. LCDs need to assist clients in meeting all their needs, be it biological, psychological, or social. Justice means treated equally. Poor or rich, old or young, kid or adult, all should be safe for the treating physician. There should not be difference in treatment based on the pain capacity or any other parameters. This requires LCD to be non-judgmental, be it literate or illiterate. Sometimes you may get a very illiterate patient, you try in your clinic and they are able to understand what you communicate with them. But it is your responsibility to make them understand and you need to talk with them coming to their understanding level. So do not think they are illiterate, cannot understand. So this comes under the justice. You need to be non-judgmental regarding all the aspects of treatment. Fidelity means loyalty or the promise to fulfill all commitments. Whenever you committed that I will take care of these patients, patient if he or she is admitted under me, many times it happens that some patients get admitted in the hospital with some consultant and patient get discharged and he or she doesn't even know who is our consultant. So this should not be there. This is dealt by the fidelity. The basis of accountability includes the professional faithfulness and loyalty to agreements and responsibilities accepted as part of the practice of thought-provoking, like the patient may indicate harm to themselves or others, like suicidal tendencies. You need to communicate with the authorities, even if patient don't want it. If the patient gives permission for the information to be shared, means consent is there, maybe for the research purpose, maybe some other purpose. Legal requirements means court of law asks you about the details of the case, and professional obligation like STDs, HIV. If you diagnose a case of HIV, it is mandatory on your part to inform the district authorities. If you are treating a patient of tuberculosis, it is obligatory on your part that you inform authorities and you will log into the portal and please share. Otherwise, this deviation from the norm that not informing TB treatment by yourself can be punished by the legal provision. This has been made punishable under the new clause. Veracity meaning truthfulness is a core ethical principle, emphasizing the obligation to be honest and transparent in one's interaction when we interact with the patient or the patient party, with other colors regarding the treatment protocol, outcome, or anything else related with the treatment. It is closely related to the principles of autonomy, as it allows individuals to make informed decisions based on accurate information. Accountability is the obligation to take responsibility. It comes from the leadership quality. You must take responsibility for all your acts. Do not divert or put it on the subordinates who acted on your orders. So it is about the acknowledging and potentially rectifying mistakes. It fosters trust, fairness, and justice. In essence, accountability ensures that individuals and organizations are held responsible for their conduct and that those who are wrong are given a recourse. Ethical dilemmas is a challenging situation where you must choose between two or more options, none of which are perfectly right or wrong, each potentially leading to negative consequences. Treatment may do good things, bring some bad things, like when we start steroid therapy during acute conditions, we know that it is a life-saving medicine, but if we use it for longer period, it may give rise to the Cushing syndrome, diabetes mellitus, and many other metabolic disorders. So there may be a ethical dilemma where to use this molecule or not. This is a simple case scenario. There are other important case scenario where there is a life or death scene, whether to choose this path or not. If I choose this, we need to in the end of your life care. It arises when conflicting moral principles or obligations create a difficult decision-making process. So why call an ethics consult? Ethics consult can help discover and understand the issues, serves as a forum for sharing of concern and questions, identifies possible treatment alternatives, provides guidance to the staff, patient and family members, and resolves conflicts. One more important point, reduces the legal burden from your shoulders. Using the process, 4 important points: assessment, planning, implementation, and evaluation. Must assess the define the ethical dilemma and the key stakeholders involved, gather relevant information and analyze the situation, and based on those inputs, generate alternative. Evaluate alternatives at which one is the best and select a course of action based on your judgment. Then implement, execute and choose an action and document the process. Then evaluate the outcome, whether it is good or bad. Take feedback from the service to whom you are giving service, then or your team members, and then make a course correction. So this is a flow chart for the approach to the ethical dilemma. Assess, planning, implement, and evaluate, and take feedback. Feedback is a very important mechanism for the ethical dilemma. Ethical decision-making process contains these steps: describe the problem, gather the facts, clarify values, note reactions, identify ethical principles, clarify legal rules, explore options and alternatives, decide on the recommendations, develop an action plan, evaluate the plan. These 10 points are very important. This slide will come again and again. So, this is first clinical daily in our day-to-day practice. Refusing treatment. Autonomous beneficence. You want to do good, but your patient refuses what to do. Like a case, Mr. Ravi Sharma, who is a 52-year-old man with diabetes and hypertension. He's admitted to the hospital with chest pain, and my chairperson is cardiologist. He must be facing this problem on a regular basis. Investigations confirm that he had a myocardial infarction. The cardiologist recommends angioplasty, which is a standard, potentially life-saving procedure. However, Mr. Sharma refuses the procedure. He states that he has full faith in his spiritual leader and does not wish to undergo any invasive treatment. He is alert, oriented, and understands the consequences, including the possibility of death. His family members are extremely distressed and beg the doctor to proceed with the procedure, insisting that he doesn't know what he is saying and that he will regret this later. So, all from the audience, what will you do? Any idea? Just a guess. As a doctor, what will you do? Patient is refusing. So, is there any ethical dilemma? Autonomy? Yes. Non-maleficence, beneficence, justice, fidelity, confidentiality, veracity, accountability. Let's see. Ethical principle involved in these particular cases. Autonomy. Patient is refusing. You cannot go against the patient will. If patient knows the outcome of his or her decisions. Beneficence, doing good, you are not able to do good because patient is refusing. Non-beneficence means doing no harm. And justice, fair treatment and legal implications of overriding a competent patient wish. So what will you do? Should the healthcare team honor Mr. Sharma's refusal to treatment respecting his autonomy, or should they prioritize beneficence and this act in his best medical interest, possibly overriding decision? Many times, autonomy versus beneficence. We need to identify whether the patient is sound enough to make informed decision. If patient is sound enough to make informed decision, autonomy gets the preference. Unless and until patient gives consent in a sound situation, you cannot give any treatment. Whether the patient is sound or not, to know this for medical good, take medical consent, psychiatrist will come and evaluate, and if the board gives that patient is sound enough to refuse the treatment, document it, just refer it. You cannot go against the patient if the patient is sound enough to make the decision. Family members, surrogates cannot make decision. The patient is alert and conscious. If the patient is alert. Discussion points: what steps should the medical team take to ensure? How to assess the decision-making capacity in such emotionally charged situation? What role do family members play in adult patient care? How can cultural and spiritual belief influence ethical medical decisions? And what documentation is needed if the patient refuses life-saving treatment? We discussed. Second case is truth-telling in terminal illness should be telehealth. Like Mrs. Meena Rani, a 68-year-old woman, is diagnosed with advanced pancreatic cancer with metastasis. The oncology team determines that her prognosis is very poor, with an estimated survival of 4 to 6 months, even with the palliative chemotherapy. Hassan meets the doctor privately and requests that they do not inform Mrs. Rani about the true nature of the illness. He believes that knowing the truth will destroy her emotionally and worsen her condition. He insists that they tell her it's just a stomach problem and the treatment will cure it. Very common situation in our clinics. Please sir, don't tell my father that he is having stage 5 CKD and he will require dialysis. Please sir, don't tell that my mom is having cancer and she will die in 6 months. Very common situation in our day-to-day practice. So Mrs. Rani, on the other hand, during the consultation, asked the doctor directly, "Doctor, is it cancer? Please tell me honestly, I can handle it." Ethical dilemma. Should the physician honor the son's request to withhold the diagnosis, or should they respect Mrs. Rani's right to know the truth about her health? So what will you do, sir? We are dealing with this. This is a very common problem. So ethical principles involved truth-telling, that is veracity. It is obligatory on our part to tell the truth to the patient. Autonomy, respecting the patient's right to make informed decision means if they are not going to survive more than 6 months, particular case where you need to tell truth or you don't need to tell truth. In highly charged emotional situation, balance should be there. If a patient